All righty. Well, hello, everyone. Welcome to Wellness on Wednesday. This is a series dedicated to promoting the benefits of walking for health improvement and reducing arthritis and joint pain. These virtual health talks, this series is brought to you by the esteemed Rochester Clinic and Lotus Health Foundation. I'm Denise Stiegel. I am the curator at livinghealthylist.com, and I am your host for Wellness on Wednesday. Rochester Clinic and Lotus Health Foundation are known for their strong commitment to community well-being and have taken the lead to organize this incredible series, which focuses on whole food, plant-based nutrition and physical activities to support arthritis health. And we'd like to thank Let's Walk Minnesota, a campaign that is sponsored by the Minnesota Department of Health and is funded by the CDC. And because of them, we are able to bring this initiative to you free of charge. So the goal of our series is to help you explore the potential of walking and offer you insights on how to improve your quality of life through movement, nutrition, and lifestyle medicine. And today we have an exciting presentation by someone I have been following for years. I have his books. I'm so excited. I'm like a little girl. It's like Christmas time. Our presenter today is Dr. Joel Fuhrman. And Dr. Fuhrman is a board-certified family physician, 7-time New York Times best-selling author, and internationally recognized expert on nutrition and natural healing. He specializes in preventing and reversing disease through nutritional methods. Dr. Fuhrman is the president of the Nutritional Research Foundation and on the faculty of Northern Arizona University Health Sciences Division. He has coined this unique term, nutritarian, to describe a nutrient-dense eating style designed to prevent cancer, slow aging, and extend lifespan. So for the last 30 years, over 30 years, Dr. Fuhrman has shown that it is possible to achieve sustainable weight loss and reverse heart disease, diabetes, and many other illnesses using smart nutrition. In his medical practice and through his books and television specials, including a TEDx talk, he continues to bring this life-saving message to hundreds of thousands of people around the world. And we are so lucky to have him with us here today. So everyone get ready to learn and be inspired. Dr. Fuhrman, welcome to Wellness on Wednesday.
Thank you. Happy to be here and excited to talk to you guys today. So my plan is to give some information out for like 45 minutes, and then we can do questions and answers. I'm going to start with exercise and foot alignment and podiatry first, because if you don't have, because I take care of a lot of people with medical conditions that have pain in their joints, and if they can't be active and walk comfortably, if their back or their knees or their feet hurt, they can't exercise and put the rest of their health into order. So this is all married together. We're talking about marrying together proper alignment of your feet with wearing good footwear, with cushion, with a wide toe box to allow your toes to spread out, because you don't want to push the toes off alignment. And also with good nutrition, so we get circulation, oxygen, and nourishment to the joints. And getting enough sleep. This is all interrelated. So I'm going to share my screen and get started, okay? Okay, I presume that you guys can see the screen, right? Okay, so we'll get started. So now, first of all, let's go through some major causes of osteoarthritis. Number one, if your body is out of alignment, meaning that your weight isn't set equal on both sides, or let's say you have a leg length discrepancy. What if one leg was an inch shorter than the other? Then it would shift your pelvis, and it would cause your body to have corresponding scoliosis, because your pelvis would be tilted, the bottom of your spine would tilt, and you wouldn't fall over, your body would tilt the spine back the other way. So a leading cause of scoliosis, back pain, and even leg and hip pain could be leg length discrepancy, which can be evaluated by a physician, and a physician could even take a pelvic film, standing pelvic film, to see the height of your, if your legs are the same. If you have scoliosis or pain related to that, something a doctor should look at, because it could exacerbate osteoarthritis. And we're talking about the major cause of poor alignment. The number one cause is foot pronation. And foot pronation leads to more excessive weight bearing on the medial tibial condyle and the medial tibial plateau, causing more wearing down of the inside of your knee versus the outside when your foot pronates inward. And if you can walk with your arches held up with a slight pigeon toe instead of letting your arches fall down, it can take weight off the inside of your knee where you have the pain. So we'll talk about that a little bit too. And then there's dietary induced inflammation of joints, predominantly from poor circulation. And we're going to talk about the link between heart disease and osteoarthritis, sludging of red blood cells, how red blood cells stick together when you have fat circulating in your bloodstream, and deficiencies of antioxidants and other anti-inflammatory compounds in colorful plants that people are not eating enough vegetables and plant foods, and excess body fat and the wrong type of fat, how it exacerbates and worsens osteoarthritis and joint pain. All right, so let's get started. This is what we're going to cover. And we'll get started with just the definition of pronation and looking at a picture of pronation. Because notice in that first picture how the ankle kind of tips inward. It's actually the joint above your calcaneus called the subtalar joint, which tilts in. And it starts with the way the calcaneus, the way the heel hits the ground. And so your foot might be a neutral alignment when you're sitting, but as you put weight on it and stand on it, it falls inward. And I'm bringing that up because supination is relatively unusual. And so most people who have foot misalignment issues are pronated, not supinated. Pronation is very common. It's about 40% of people have significant pronation that could lead to development of foot problems, knee problems, back problems that come from the foot being out of alignment. So we start at the bottom of the body and make sure the foot is properly aligned. And the problem with the foot being poorly aligned is that as the subtalar joint, the joint between your calcaneus and your talus falls inward like that and is not held in, you're not cultivating the strength or the positioning to hold it up. You're going to put more weight on the medial condyle. You see the knee has two sides to it, an inside and an outside. The medial side is the inside, and that's the inside of your knee is where people mostly get pain. And when people are getting knee pain, we have to look at their feet, or we should be looking at the feet throughout whole of life to prevent the development of knee pain in later life. So we age the joint more rapidly if the foot's more out of alignment. So we're looking to fix that. And here's a orthotic that I bought on Amazon. I don't think we have to mention names, but it's a good quality orthotic. It could fit in a shoe, and it even has an inner heel post. If you look at that towards the heel, I put it on a sheet or something and took a picture of it last night, and it even has that little lift under the heel. In other words, it's posted to prevent the medial, the inside, from dropping down. And what I do is I take the lining that's in the shoe already, and I cut out like a 1/2 inch strip of the lining I'm throwing away, and I glue it with contact cement, and covering the post of this store-bought orthotic, so I can add more medial support to the orthotic to help my foot be in neutral alignment. In this one, I also glued a little piece under the fifth metatarsal, but right behind the fifth metatarsal head, to unweight the fifth metatarsal, which was bothering me with a lot of hiking and walking at one point. But in any case, I showed how the adjustment was made to the base of the orthotic to cant it or to balance it, to adjust to the amount of pronation I have. And then sometimes you could actually take a rubber inner heel wedge, which you could buy for like $1 or $2. You can buy a whole pack of these and glue them with rubber cement or contact cement into the inside of the shoe and set the orthotic on this inner heel wedge. And so what I'm explaining here is like the base of the foot. I drew those little dots on the 5 metatarsal heads, 1, 2, 3, 4, 5. If my first or second metatarsal head was hurting, I could glue a lift. It's called a metatarsal pad, but I could cut one with a scissor. And I can glue a little piece of my lining of the shoe or lining of the inner lining of the shoe I'm throwing away. Notice how I'm gluing it not under the point of pain, but right behind it, so it unweights or takes weight off the bones. The head of the bones, those metatarsal head, you can feel under your feet. A lot of times when people have foot pain, I'll take some lipstick and I'll put the lipstick on the point of pain on their foot. Like I'll feel for their metatarsal head that has the pain, And it could be, a neuroma in between, or it could be under the head of the, on the bone that's barred. The fifth bone is common, the first one is common, or the second one is even common source of pain. So I'll lipstick the exact spot of pain, put a little dot of lipstick on that, and have them step onto that orthotic or the base of their shoe, marking exactly where that med head is that has the pain. So when I glue my pad, I can make sure the pad is glued right behind it, close to it, but right behind it to take pressure off of it. So I have the lipstick spot, which, imprinted the lipstick mark on the orthotic, and then I can feel to put the lift under the orthotic right behind that lipstick spot. And this little schematic piece of paper I drew, I put 2 pieces of cushion right behind the 5th metatarsal and one behind the first 2. And, so those are just called metatarsal lifts or something. And so the other thing we're talking about here, a leading cause of arthritis, is that the joints, and they were talking here about the cartilage that lines the joints, gets most of its food, its nourishment, its nutrients, its oxygen by diffusion through the synovial fluid, through the fluid that bathes it. It doesn't have a lot of blood vessels that supply oxygen and nutrients to the cartilage, other than how it's bathed in the synovial fluid, meaning it's a microcirculation with very, very tiny blood vessels. And if you have a little too much fat in the blood, especially saturated fat, or a little bit of atherosclerosis, where your body is starting to get hardening of the arteries, the first thing that you see is damage to your joints start to get damaged, and you have osteoarthritis developing as your heart is getting blocked up. So what I'm saying here is that maybe 10 or 20 years before the atherosclerosis advances enough to cause a chest pain in the heart, it's going to have to age the joint decades before that, when you start to get impairment to the microcirculation to the joint tissue. So actually, joint osteoarthritis and aging of the joint is a sign that you may develop heart disease if you don't do something to clean up your act, because the joint is a fragile, or an alarm system to let you know something's wrong with your diet and you're not getting good microcirculation, causing inflammation in the joints. So again, we want that joint fluid to get adequately oxygenated. And we know that the scientific literature shows people with osteoarthritis are 3 times more likely to develop cardiovascular disease, because they have similar causes, and even heart failure, compared to those without osteoarthritis. So we eat right to prevent osteoarthritis. Sure, we exercise right, and we look to have correct alignment and proper posture. But we also have to, the most important thing, and the reason why osteoarthritis is so ubiquitously present, is because heart disease is so ubiquitously present, because we're eating a diet that destroys our circulation, our circulatory system. And the number 1 cause of death in the United States in adults is heart disease, heart attacks and strokes. And this link of joint pain and heart disease is especially strong when certain joints, like the knee or hip, are involved. And you'd say, well, I have knee pain, that means I'm going to have heart pain. Well, maybe, but you got to be careful. So we got to do everything right. We got to eat right to protect our joints. And this is a picture of red blood cells in a rouleau formation. The rouleau formation means they're stacked like coins are stacked and they're sticking together. Because when these red blood cells stick together, they can't enter the microcirculation and diffuse across the joint capsule to bring oxygen to the cartilage that gets to get nourishment. What I'm saying right now is, when your red blood cells get sticky, they can't get good perfusion into these tiny, tiny, tiny blood vessels that bring nourishment to the joints. And of course, what makes the red blood cells stick together, and what makes us lose microcirculation of the joints, is because most Americans get their fat in their diet from animal fats, like animal products like meat and cheese, or from vegetable oils. They pour oil over their food. As opposed to, I don't eat animal fats and vegetable oils. I don't eat a low-fat diet. My diet is moderate fat, but I get the fat intake in my diet from nuts and seeds and some avocado. And those are whole foods. It's not the oil taken out of the nut, not the walnut oil, it's the whole walnut. Because when you get your fat from a whole food like walnuts or almonds or avocado or sesame seeds, then the fat is more slowly absorbed into the bloodstream, and the body can preferentially burn it for energy and not store it as fat. But also, you're getting your fat with other antioxidants, lignins, and other phenols, there's other nutrients we get with nuts and seeds that are anti-inflammatory on the cardiovascular tree and the heart. And these fats, especially ALA from walnuts, flax seeds, chia seeds, hemp seeds, the alpha-linolenic acid you get from nuts and seeds has anti-inflammatory effects on the heart, preventing cardiac arrhythmias and letting the heart cells be less irritated and likely to go into an atrial fibrillation or abnormal heartbeat. Now, so I'm saying two things. One is I make salad dressings, sauces, and even desserts by mixing nuts and seeds. A dessert like frozen bananas with vanilla bean powder and a few walnuts to make a banana ice cream, or a sauce like with tomato sauce and almonds with some black fig vinegar and some roasted garlic to make a salad dressing or something. I'm making dressings, sauces, Thai curry sauce. I'm making it from nuts and seeds, not by pouring oil in, but by pouring the nuts and seeds in and blending them in a blender. So making sauces and dips from nuts and desserts from nuts and seeds, not from using oil. And then I'm also paying attention to the omega-3 index on the red blood cell membrane, which correlates because that has other anti-inflammatory effects, which have beneficial effects on the brain and the joints. So the omega-3 index is a blood test. And sometimes people need to supplement with an algae-based oil that supplies EPA and DHA, which people commonly call fish oil, but you don't have to get that from a fish source. You can take it from a vegan source to supplement your diet to make sure your omega-3 index is in that most favorable range to protect the brain and to protect the joints. So we want ideally the omega-3 index to be above 6, and we do that by eating more omega-3 nuts, meaning walnuts, flax seeds, chia seeds, hemp seeds are high omega-3, and using nuts and seeds as our source of fat, not oils and animal fats. And then if we need to supplement, if our level is still too low, we can supplement to get our level of omega-3 in the most favorable range. Because when we get our fat from animal fats, like from meat and cheeses and bacon, whatever, then it's shown that saturated fat in studies doesn't just raise cholesterol and weaken your heart, it also weakens the joints. So it ages cartilage and makes cartilage become more prone to damage and gets crushed and wears away faster when our fats in the body are more saturated. And also it's known that commercial baked goods like white flour and sugar products and processed foods and fried foods also have negative effects on joints, not just on the heart. So it's kind of interesting because the same foods that are most linked to heart attacks and strokes, and the same foods that are linked to even cancer, like fried foods and animal fats and commercial baked goods, are also linked to joint damage and aging of the joints. So it's like there's not one diet good for heart attacks and cancer, then another diet good for the joints. It's the same diet that's good for your whole body. It just ages you slower in general. And we got into this idea that vegetable oil, saturated fat from animal products are bad. So we're pouring vegetable oil and olive oil over our food and realizing that, well, maybe if you're a, LeBron James or some world-class Roger Federer or some world-class athlete, training all day long, you can have a little oil and still burn it off. But most people don't exercise that much. And if they don't have enough caloric room to have all those healthy foods they're supposed to be eating the nuts and seeds and still have extra calories left for the oil. The point I'm making right now is that oil is absorbed rapidly. It's an appetite stimulant. It goes from the lips to the hips in like 5 minutes. It's not absorbed slowly and preferentially burned for energy. It makes people fat. And if you're not highly active and you're overweight, then the oil you're consuming, any oil, even a more favorable oil, like olive oil, if it's contributing to body fat, it's not favorable to you. So we've got to adjust our caloric needs by taking out the foods that taking out calories that are empty calorie foods like oils. Nuts and seeds are not empty calorie foods. They're nutrient-rich foods with protective nutrients that protect the body. And we know that when you heat oils, they become rancid, and it accelerates aging and joint damage when you're eating fried foods. And of course, the U.S. Southern diet has the highest stroke and heart attack rate in the world, not in the whole world, in the southern parts of the United States, we eat so much fried food. So I'm saying vegetable oils, especially cooking food and heating the oil up and frying foods, particularly damaging. And fat on the body, also creates inflammation. Body fat creates inflammation. So body fat is poorly perfused tissue. I said earlier that joints don't get a great blood supply. And your body fat doesn't get a great blood supply either. And body fat is a storage dump of retained waste products. But of course, it spews out pro-inflammatory compounds like lipokines and cytokines, which age us. And also body fat makes us insulin resistant, which raises blood glucose and of course raises insulin production by the pancreas. So we have high insulin, high blood sugar, and that's not good for your joints or your brain. So fat on the body increases risk of heart disease, cancer, strokes, depression, and cancer, strokes and depression. But fat on the body also ages our joints too and puts more weight on the joints and puts more inflammation in the joints. So there's no such thing as a healthy overweight person. All people that are overweight are unhealthy and at higher risk of disease. And what by even an overweight person, and even people who are not obese, still may have too much body fat on their body. We just found out with recent studies that they classify people who are with a BMI above 30 as being obese, but now we're finding that people even with BMIs in the normal range, but 25 and 30, that's just overweight, not obese. A lot of those have more than 30% body fat, and which also classifies them as obese, even though the BMI doesn't classify them as obese. But for optimal lifespan, we need to have a body fat for males below 15% body fat and for females below 25% body fat. I'll say that one more time. If you do a body fat determination, you're a female, you need to keep your body fat below 25% for good health and a male below 15% for good health. Otherwise, you have too much inflammation and too high insulin resistance, and you're aging your whole body. So we have to eat the right foods, and people can't lose weight in this country because they're not eating enough healthy foods. So they're always craving extra calories because they're nutritionally deficient from all the processed foods they're eating. I'm saying that there are three types of food: animal products, processed foods, and produce. And both animal products and processed foods do not contain phytochemicals and antioxidants that contain those anti-inflammatory substances that protect against cancer and make us age slower. And when you flood the body with antioxidants and phytochemicals from colorful plants, it makes you desire less calories and you're more satisfied with the right amount of calories. So here's, for example, the data on 2.3 million people in a study showing that being overweight is a risk factor for infection. I mean, many people know that even with COVID deaths over the last few years, which drastically increased with people that are overweight. But of course, we knew that being overweight was a risk factor from pneumonia, flu, and other infection, or even a few pounds, even 5 to 10 pounds of being overweight can increase your risk of premature death due to an infection earlier in life. So we have, people eating fast food and white flour and breads and pizzas and burgers and all kinds of, donuts and cookies and crackers and all kinds of junk that are not food. Those are drugs. They work on the body like a drug because they don't supply us with nutrients, with micronutrients. They just supply us with empty calories. And we can't even convert it into energy. So it's more readily converted into fat and leaving the body lethargic and then craving more food. So when you eat nutritionless food, it makes you desire more food and you have to become overweight. So when you put empty calories in your body, you have to become overweight. And that's why all Americans are overweight. Now, let's compare that to studies done on people who eat nuts and seeds as a source of fat. So here's some studies that all corroborate each other. The Adventist health study, the physician's health study, the nurse's health study. We show a dramatic reduction in all causes of death when people eat nuts and seeds and a dramatic effect on increased lifespan. And I'm saying a dramatic effect on your joints. Here's the physician's health study, which showed that eating an ounce of nuts or more a day was associated with a 60% reduction in sudden cardiac death. A dramatic reduction in sudden cardiac death from people eating nuts and seeds because of its antiarrhythmic, its anti-inflammatory effect on the heart, which also has an anti-inflammatory effect on your joints because it prevents sludging of the blood and low formation of the red blood cells. So the cartilage in your joints are able to get nourished when your fat comes from nuts compared to vegetable oils and animal fats. So here's a meta-analysis consuming of many different studies and taking people to looking over about over 44,000 deaths, showing that all-cause mortality was decreased by about 30%. And the group in the Seventh-day Adventist Health Study 2, the group with the highest intake of nut and seeds, eating more than 1.5 ounces a day, had a 40% reduction of heart disease deaths compared to those with lowest intake. And that helped up in every cohort. People who are vegans, non-vegans, flexitarians, some people eating more meat, some people eating different races, different ages, different sexes. It showed up in every cohort, eating more nuts and seeds showed less all causes of death. And here's a study I published in 2020 in the International Journal of Disease Prevention showing nuts and seeds for heart disease prevention. I could write a same study and write nuts and seeds for joint disease prevention, not just heart disease prevention. We could put about and there's more than 50 references there. And there's a study I published in 2015, improved cardiovascular parameters with a nutrient-dense plant-rich diet style. And I had more than 400 people drop their blood pressure 26 points by eating what I call a nutritarian diet. In this case, we're calling it a plant-rich diet, nutrient-dense plant-rich diet, which means we're eating lots of foods that are known to protect against diseases. And this is a vegetable-based nutritional recommendations. It's not, the American diet is grain and animal product based. People eat very little vegetables in this country. As a matter of fact, Americans only eat 2% of their diet from vegetables. And I'm saying vegetable based means mostly what we eat should be vegetables. We should be eating like 50% or more of vegetables. Then we can eat fruits and beans and nuts and other foods, but vegetables are the foods that show the most protection against heart disease and the most protection against blood vessel disease. So we know as vegetable portions a day increases, intravascular inflammation decreases, blood vessel function and delivery of oxygen to the joints improves, reducing heart attack and stroke risk and reducing aging of the joints. And I'd like you to memorize these 10 words or so. Here's the 10 words I want you to memorize. Raw vegetables have the most consistent and powerful association with reduction of cancers of all types. I'll say that one more time. Raw vegetables have the most consistent and powerful association with the reduction of cancers of all types, meaning that you should be eating a salad every day. So do you guys have a salad at least once a day where you have lettuce? Because lettuce is a superfood. It's the richest source of sulfoquinavose, which fuels the growth of good bacteria. Then we put some, green cruciferous on it, like arugula or watercress or kale or collards or bok choy or some kind of other green with it. We mix it with scallion or onion. We put a nut into dressing made of nuts and seeds. Sometimes I'll just whip up an orange with some cashews and hemp seeds and a little blood orange vinegar, a little squeeze of lemon or apple cider vinegar, and put a fruity based dressing on top. But yeah, I have a salad every single day, and I have this acronym called G-BOMBs, so people can remember these 6 foods that have been shown to have the most scientific references showing their protection against cancer. And these stand for greens, of course, beans, onions, mushrooms, berries, and seeds like flax seeds, chia seeds, sesame seeds, which are so powerfully protective against cancer. So the question is, do you eat these foods every day? Do you have some mushrooms in a mushroom soup or in a dish at night with a vegetable wok? Are you putting raw onion on your salad every day or scallion? Are you having at least half a cup of beans a day? Are you eating fruits every day with some berries or cherries in there? Are you eating green vegetables, both raw and cooked, every day in your diet? Because we know that most Americans eat most of their diet from refined products and animal products. They don't eat much fruits and vegetables. Look at that. 2% of their diet. I always say this diet's designed by Al Qaeda. It's like made to kill people. We have these weapons of mass destruction who are aimed at us from fast food restaurants and people putting these things in their mouth. Why do people behave in self-destructive manners, impairing their own body and causing them to get disease? Is because these foods are highly addicting. They rush into the bloodstream very fast. They're so rich in calories, these fast calories. They put so much caloric rush into the bloodstream that it stimulates brain centers, the dopamine centers in the brain, that make you uncomfortable if you don't keep overstimulating your brain with excess calories. So we got to get off that. And we also know that high protein diets generally mean more animal protein, because animal products like eggs and meat and chicken are richer in protein, richer in complete protein than plant foods, but actually most will get protein poisoned by too much animal protein because it raises hormones that age us and causes and allows cancer cells to replicate. And these proteins are associated with saturated fat, but it raises hormones like IGF-1, which is a growth hormone, which allows cancer cells to replicate. And more animal protein we eat, the more it creates certain bacteria that live in the gut that produce pro-inflammatory compounds, like TMAO, trimethylamine oxide, which also can inflame the joints too. So we're saying, here's a study, for example, that showed that more animal protein, more early life death, and more high protein plant foods, more longer lifespan. So what's a high protein plant food? Well, almost all plant foods are high in protein, unless you're eating oil. If you're eating nut and seed, you're getting protein. If you take the oil out of the nut and seed, you threw the protein out because it was in the original food. And except for fruit, whole grains, vegetables, beans, and nuts and seeds are all protein-rich foods. You get sufficient protein from plants when you eat the whole food. Not when you're just having sugar and oil, but when you get a whole food, like a whole grain, like oatmeal or amaranth or teff or quinoa, and you're eating vegetables or different colorful vegetables, different types of vegetables. You're eating nuts, you're eating beans are really high in protein. You get enough protein from plants, even if your diet is all plants. But the more plants you eat, but what these studies show, the more plant protein foods you eat, the longer you live. So here's 4 different studies done every few years. There's more studies published on this. And I'm saying that it gives these studies high amount of credence because they show the same thing. They show more animal protein, more early life death, and more plant protein intake, longer lifespan, and slowing of the aging process and protection of the joints. So the key to living a healthy life is eating more plant protein, eating less animal protein. So what I'm reviewing here on the slide is that the phytochemicals from G-bombs and other colorful plants with exercise, with having a lean body, those are the secret, right? Caloric restrictions. So you're getting, if you eat enough high nutrient foods, you're instinctually satisfied with the right amount of calories. You're going to be comfortable eating at a favorable weight. And when you do the right things, it builds up SIRT1 and AMP kinase, these longevity proteins that stabilize our telomeres and reduce inflammation, prevent oxidative damage, and increase stem cell maintenance to repair even worn out cartilage. Your stem cells can repair that. And so you're increasing the body's repair mechanisms and slowing aging when your diet is phytochemical rich and you don't overeat. Whereas mTOR is elevated with 100% of cancers, but when you eat excess animal protein and excess calories or extra high glycemic foods, like high glycemic things are sugary things like white flour is a sugar equivalent, comes into the bloodstream as a load of sugar. And we're talking about sugar, white flour, honey, maple syrup, any of these sweetening high glycemic foods raises these mTOR and other parameters that age us with more inflammation, more oxidative stress, means free radical damage, and more joint damage. So, for example, here's a study on cruciferous vegetable intake in more than 100,000 Asians, showing that the more green vegetables eaten, the longer people lived with no threshold effect. And what I mean by no threshold effect, with tomatoes, it's a threshold. With mushrooms, it's a threshold. Threshold means that once you had half a cup of onions, you're getting the maximum benefit. So having 2 cups is not better than 1 cup. If you had 1 cup, that's good enough, or a half a cup is good enough. With tomato sauce too, once you have a cup of tomato sauce, having an extra cup's not going to give you more protection. You already had the half a cup a day. Once you had but with green vegetables, that's not true. As people went from 1 cup to 2 cups to 3 cups to 4 cups, it still enhanced human longevity. We are a green vegetable dependent animal. And you could say the immune system, that especially the defenders of the gates, the interepithelial lymphocytes that line the villi and the digestive tract, they develop their immunity and their strength based on green vegetable consumption. The green vegetable compounds fuel the development of normal immune function. I'm saying without green vegetables, you can't have normal immune function. You can't be normal. You better live close to a hospital if you're not going to eat green vegetables, because you're going to need one event. You got to eat green vegetables if you want to be healthy. Our body is a green vegetable dependent animal like the other primates. So I'm wrapping this up. And what I've taught you today is that more greens, more beans, even though we didn't talk much about it, but beans are a super longevity promoting food and strength promoting. More nuts and seeds in the diet means lowering of the glycemic load, which means the sugar in the bloodstream, right? Reducing diabetic and cardiovascular parameter, more oxygenation of the joints, and longer lifespan. So we want to eat a diet that has vegetables at the base. Here's my nutritarian food pyramid. We have vegetables at the base of the pyramid, not grains and not meat. And then we eat fruits and beans and whole grains and nuts and seeds. And animal products are something people could eat sparingly or as a condiment or not at all. But we're trying not to eat any foods that are processed foods or foods that are more pro-inflammatory, especially beef and processed meats and greasy foods and fried foods and white flour products should never be eaten. Why would we self-destruct? Or why would you put things that are not good for your long-term health? Shouldn't you be performing in a manner to protect your own body? You only get one body in this life. And if you're putting things in your mouth that are not good for you, then you're not loving yourself and taking good care of yourself. And you're not being the full, you've got to be a role model of good health to have a good effect on other people, to have goodwill for others. You have to take care of yourself adequately, so then you can take care of others adequately. If you take care of yourself, if you're not taking care of yourself, you can't take care of anybody. So a nutritarian eats a variety of high nutrient plants, a wide variety. And we avoid empty calorie processed foods like sugar, white flour, sweeteners, and fast foods. And we use little or no oil and little or no animal products. We're eating, instead of using those foods for fat and protein, we're getting our fat and protein from beans and greens and vegetables and nuts and seeds, which a lot of people don't know have lots of protein. Beans are like 30% protein, right? We get a hamburger is like 30%, but so is a bean dish. But we get more of our protein from the beans and the nuts and the greens, then we're moving anti-inflammatory, protecting our heart, protecting us against cancer, and protecting premature aging of our joints. So be active, take away your pain, get the right footwear. We want wide toes shoes that can hold an orthotic. So when you buy an athletic shoe, you want a liner that you could pull out and put a better liner in that gives you some arch, some support. For example, like here's an example of here's that inner heel, posted inner heel. This is not expensive. You could adjust it. You could by gluing things on the bottom, or you can adjust it to the levels you want without spending huge expenses. And then, so we want people to eat at least a cup of beans every day. We want you to eat at least 3 fresh fruits a day, 3 to 6, and have some of those be berries. You want at least 1.5 ounces of nuts and seeds a day. I eat about 3 ounces a day because I'm doing a lot of exercise. But at least we strive to have like 0.5 ounce with each meal, because a tablespoon of ground seeds in the morning on your oats or on your quinoa with berries and plant milk, and then we maybe have a salad dressing with nuts and seeds in it for lunch, and maybe a Thai sauce or some cream sauce or a dessert with nuts and seeds at dinner. We're having at least 1 big salad a day. I'm having some steamed and wok vegetables, or blanched, some kind of vegetables like broccolini and broccoli and cabbage and mushrooms and onions and, some of the, different vegetables, both cooked and raw. And I'm putting some mushrooms and onions, mushrooms mostly cooked, onions both cooked and raw, but I'm trying to have some raw onion or raw scallion every day because of the powerful anti-cancer benefits they give people. And I guess I'll stop the screen share. I'm done giving you the slides, and I guess we can pause now and I can talk more about what you guys want me to talk about and take your questions.
I think that would be great. Thank you so much for this incredible presentation. I've been writing notes. I love to write notes, and we've taken some photos of some of the slides because they're just so powerful. We do have a handful of questions that came through the chat. Judith, you had one of the first ones. If you would like to come off mute and ask Dr. Fuhrman your question.
What's interesting, he kind of answered my question at the very end, because I have a lot of trouble with raw onions, not scallions, but other kinds of onions. And so if I braise them in water for a while, it seems to not hurt my stomach so much. But it sounds like I should still try to get in those raw scallions, which I always have in my refrigerator, some more into my diet.
Yes, and because people aren't healthy enough, they sometimes have poor digestion, but they can improve their digestion over time. But like you said, you eliminate them completely, take them down to the level which doesn't bother you too much, or a safe level. And over time, usually the digestion can improve and you can handle a little more. But scallions are like the most healthiest things you can eat, superfood. You can have those, but you can just a touch of onion, one little onion ring chewed really well with the rest of the meal, and see if you can tolerate that. Because if you do that for months, over time, you'll be able to tolerate more. But if you do what I'm saying and have a salad every day and you chew it to a liquid in your mouth, and you eat the other healthy foods, and you reduce the inflammation in your body, you'll improve your digestion and able to digest raw foods better. But don't forget, we don't have teeth in the stomach, and we should try to liquefy everything in the mouth to digest better.
Thank you.
Kind of along the same line, this just came through. Al, do you want to ask the question? Or would you like me to? You can come off mute if you would.
Yeah, my question had to do, I'm kind of lazy when I prepare vegetables. When I eat a lot of vegetables, I tend to boil them rather than stir fry or so on. Just the question is, I've heard that about boiling vegetables takes away some of the nutrient value. Is that true or not true?
It has to do with how long you put them under the boiling water. If you put them in a basket and put them in there for just 90 seconds and pull them out, it's called blanching them. And so you can make them so they're like a little bit, not so smushy, but a little bit still firm. Then you're going to keep a lot of the nutrients in. So yeah, just don't overcook them, But I still want you to eat a salad, because don't forget, lettuce is a superfood, and eating some raw leafy greens like raw arugula or raw kale or raw bok choy is important for good health. So even though you're eating most of your vegetables cooked, I still want you to have a salad every day if you could.
Wonderful. Dr. Fuhrman, this makes me think of something. Very often people will say to me when I'm working with them, oh, but raw vegetables, they give my stomach, they're hard to digest, I have trouble with them. So you just made a very good point about blanching vegetables. It's not a long time, but I think it takes that, the raw flavor away, but also I think helps people to eat more vegetables that typically they would say, oh, that bothers my stomach.
Well, that's why we eat both raw and cooked vegetables, because if you eat it all raw, you don't eat as much as if you by eating raw and cooked, it gets you to eat more vegetables. Absolutely.
Awesome. Now, Mary has a couple of questions. Mary, if you'd like to come off mute.
Hi, Dr. Fuhrman. I was wondering about the omega-3 index. I have had my omega-3 index tested, and I do flax and chia and walnuts every day, and I'm still low on my omega-3. Do I need to supplement with a kelp or something? And how do you find, if I had to, how do I find the right thing that doesn't have contaminants?
That's a good question. And the point is that there's been numerous studies, like 20 different studies, show that on plant-based or vegan diets, people not eating fish, that some can eat more flax seeds and walnuts and have an adequate level, but most people do not have an adequate level. Most people, if they're not eating seafood, do not have the ideal level of omega-3 index. And supplementation with an EPA and DHA supplement, I have recommendations you can look, but supplementing with an omega-3 supplement to get your level above 6 protects the brain from shrinking with aging. So it's important to keep your omega-3 index favorable in life and not to ignore that, because in a plant-based diet, all plant-based, totally vegan diet, you're not getting ideal levels of vitamin B12. You need to supplement with B12.
Mm-hmm.
You're not getting ideal levels of zinc, because the phytic acids bind zinc, and you're not getting ideal levels of EPA and DHA. So those are the three most critical things to supplement with on a plant-based diet. Repeat it again: B12, zinc, and EPA and DHA. So you need, if you want it as a vegan, you don't have to take fish oils. You can take an algae-based, not kelp, and not, that's not the kelp is an iodine, not for DHA. It's an algae-based DHA EPA supplement.
Oh.
Okay. And you have to supplement with the amount that brings your level above 6 on the omega-3 index. Most vegans need to take that supplement. Okay, next question.
Okay, let's see. We have one here from Letitia. Letitia, you want to come off mute? Maybe you can't come off mute.
Okay, I can come off
There
mute.
you are.
Sorry. Yeah, so I see you mentioned some specific like bok chow and arugula for salads. Wondering where romaine and spinach fall on that, because I typically mix some spinach and romaine lettuce because I like the crunch of the romaine, but really don't want to focus on things that aren't going to really be good nutrient dense for the body. So what are your suggestions as far as like making a good salad? Do those two fall in the superfood category?
Yes and no.
Okay.
Number one, yes, lettuce is a superfood, and people don't realize lettuce is a superfood. That green lettuces like romaine and Boston and green ice and all these different lettuces and the mixed baby greens, they're all very important for human health. And they don't have oxalic acids. They're very, which means they're low oxalic acid foods. They don't bind calcium, so their calcium is readily available. Whereas spinach is a high oxalic acid green vegetable. Even though it has anti-cancer effects, you don't want to eat more than 25% of your raw salad or raw intake from spinach, because it's too high in oxalic acid, which binds calcium. And for some people, it could be even, give them, be linked to kidney stone formation. So lettuce, yes. Spinach, yes, but not more than 25% of your green intake. But the most important thing you're leaving out is the most powerful anti-cancer food in the dietary landscape, which is green cruciferous vegetable, especially when you eat some raw in your salad, like bok choy, kale, arugula, watercress, Brussels sprouts, broccoli, cabbages. So red cabbage so we'll put some arugula, red cabbage, or bok choy on the salad too. Just mix a little of that in there, because a little of those foods raw are probably the most, or sprouts or broccoli sprouts have the most powerful superfood containing substances that prevent cancer. So yes, mix all those good things into your salad. A little spinach, but don't forget a little cruciferous green like arugula or cabbage or bok choy or kale too.
Sounds great. Thank you.
Delish. You're making me hungry. Let's see. Next question is from Steve Thompson. You're still on mute. Do you want me to come back to you, Steve?
If he post in the chat, maybe just read it to me if he has.
There you go.
Oh, there he goes.
Okay, am I unmuted now? Okay.
You are now unmuted.
So I'm on my iPad instead of my computer, so I couldn't find where the button was. Is there any compromise that you found, Dr. Fuhrman, using frozen vegetables instead of fresh?
Yes, I think frozen vegetables are excellent food. Let me tell you why they're such good food. Is because they're picked and frozen the same day they're picked. And they're only cooked for 60 seconds, blanched and put back and refrozen. Like when you buy broccoli in the supermarket, it might have been picked a week ago. And then you bring it home and you keep it in your refrigerator 3 days. Now it's 10 days since it's been picked. And then you overcook it and you make the water green. And so, but when you get frozen broccoli florets from the store and just defrost it, they cooked it the same day it was picked, and they only cooked it for 1 minute. And then they flash froze it. So you're actually getting more nutrient retention. And why not? Frozen foods I travel a lot. I make frozen asparagus, frozen broccoli florets, frozen peas. I'm always getting, and I use frozen wild blueberries and frozen berries because when you get fresh berries, a lot of times if you buy the organics that are not made with fungicides, they go bad and turn moldy. Mm-hmm. And they're picked and they're traveling across the country. And the time they get to you in your refrigerator, they're going bad already. So when you buy frozen, they're not treated with fungicides because they're kept in the freezer. And also you can take out the amount you need and let it just gently defrost and not have any waste and have people get rotten. So I'm a big advocate of people using frozen vegetables and fruits to make their diet more accessible and make these healthy foods more available year round.
Very good. Next question is from Suzanne.
I'm here eating my green salad.
Okay.
With walnuts.
Great.
Hi. So impactful for me. I'm doing all the things with food, trying to reduce my risk of stroke, family history, really scary. And I'm looking to reduce my blood pressure even more and get off the medication that I was prescribed. I only needed it when I gained weight. So all of this is really hitting home. And in the last 2 months, I've dialed in everything, doing everything you just talked about. And I've lost 25 pounds. I'm sleeping better. Nothing hurts. My knees are awesome. I'm back to, exercise. But the blood pressure is still not. I'm on medication again, but it's still not.
Have you cut all the salt out?
No.
Well, salt causes intravascular inflammation and hemorrhaging, and it's your lifetime exposure to salt that determines your stroke risk. Not the amount of salt you took in the last 10 years of your life, but your lifetime exposure to salt. So you're not doing this program. You're not if you're salting your food. And I guarantee you, if you took the salt out of your diet, you wouldn't have high blood pressure anymore. And the reason I could say that is because your weight is coming down nicely.
Yeah.
So your weight is coming down nicely and you're off salt. There's no way you have high blood pressure. No way. You
And
just
even the pink Himalayan salt and the fancy salt,
why does that matter if the salt comes from the back of the moon, the depths of the ocean, or came from Venus? It wouldn't matter. It's the amount of sodium you're taking in. If you can't get 700 milligrams of sodium in your diet if you're eating natural foods, the natural foods, fruits and vegetables, always have less than 0.5 milligram per calorie. So you're getting between 500 and 700 milligrams of sodium on the natural foods.
Mm-hmm.
It doesn't matter what kind of sodium, these nonsensical ideas that you can take, like Celtic salt or Himalayan salt or salt from the rock of Gibraltar, or the bottom of the deepest trench, and it doesn't matter. It's still sodium. Get the sodium out of your diet, and it deadens your taste buds for salt. So you can't taste food anymore. Romaine lettuce has no flavor because you're salting things.
Mm.
And you have to start now because it's already too late, because you cause microvascular hemorrhaging. In other words, your lifetime exposure to sodium over time, over decades, weakens the interior lining of the blood vessels.
All right.
Today's the day to get the salt out of your diet.
All right.
Good
Any
luck.
alternatives to salting meat or potatoes? I don't put any salt on salad or greens or anything.
You should be eating meat or potatoes. What do you mean salting meat or potatoes? I thought you're on a nutritarian diet and not eating meat anymore.
Chicken, fish.
Okay. And you're not on a nutritarian diet.
Okay.
In other words, if you're eating animal products, if you are, then I don't want that to be more than 5% of your total caloric intake. So you're not really doing this program and if you have high blood pressure, you probably just cut it out completely and go vegan without salt for now. And it doesn't and the idea that how do I make things taste good? You made things taste bad by eating the salt, because the salt weakened your taste muscle. So you can't taste what vegetables and fruits really taste like, because the chronic use of salt has deadened your taste. Yeah. So once you have the salt out of your diet for a few months, you will see that foods taste really much better than you thought they taste.
Well, that definitely happened when I gave up.
I have sauces and dressings and spice. We have all these incredible recipes. As you know, I've written many books with recipe books and discuss some of the Thai curry sauces. There's the Eat to Live cookbook. I'm not supposed to promote anything here, so I didn't say that. But in any case, we're talking here about, we have plenty of information for you to learn how to make healthy foods taste great. And this little presentation should be a tiny introduction to want you to learn more by reading and learning how to do this better, because you're not doing it strict enough or correct enough to get the real benefit you need to get, because your blood pressure should have been normalized by now.
Okay.
Don't forget, if you're a type 2 diabetes, I have 75% of people following my program become non-diabetic within 6 weeks, and 95% become non-diabetic within 6 months. Wow. And with the blood pressure, it's almost the same exact thing. I just showed you a study on this presentation where I had about 440 people drop their blood pressure 26 points within the first 6 months. While the medications were taken away, the blood pressure still lowered 26 points. So the main concern is, when you're eating this way, it drops your blood pressure so effectively, you got to be careful not to be over-medicated to push your blood pressure too excessively low. So you have to be, watching and checking your blood pressure sufficiently. So your doctor knows to cut back on the medication. You can discontinue in time, so you don't fall on the floor and faint from low blood pressure, from being over-medicated.
Yeah, I've reduced it by half so far. So I feel like I'm headed in the right direction.
Thanks for the questions, because
Thank you.
your participation in questions gave enabled a lot of people to get more information. So that was very good. Thank you.
Yeah, thank you.
Wonderful. Thank you. Now we have a couple of questions from May.
Hi, I want to echo what Dr. Fuhrman say, and I do have the gray books, and you can check this out from library, and people can change that within 5 days, as what we have seen. So my first question related to arthritis is, what for people who are overweight, and they have developed the joint pain, and they also they overweight and they joint pain, arthritis, what would you suggest the first step for them, and what kind of exercise and movement you would suggest for them?
It depends on the person. I see lots of people who can't even walk without pain when they're here, and we have them walking in the pool. They're doing their walking in the swimming pool back and forth. Because I see people that weigh 400 pounds or 350 pounds. But after I had a person here for 3 months, he lost 100 pounds in 3 months, and he was walking in the pool for like an hour, 2 hours a day. And then but now the people are able to walk. And to do other, and we do other parts of the body too. We do other body parts, not just, so they can do a sitting machine, a sitting leg spinning machine, or they're doing other types of exercises with pulleys and machines. They do whatever they can do, but certainly walking in a pool is excellent for people who can't walk a lot. And then once they lose more weight, then they can walk, but as you know, we correct their foot alignment, we give them more cushioned footwear, we give them the orthotics, and we get them walking in the pool. And then eventually they do a little walking at a time, they get more walking and more walking as they lose more weight. And sometimes what we do with people is with arthritis is we give them shockwave treatments, which are like soft wave. You can look it up on the internet, called soft wave CRT, which is it helps restore healing of the joint to the knee or the hip or the ankle, Achilles tendonitis, frozen shoulder, carpal tunnel, osteoarthritis, or cartilage injury of the knees. We're able to break down some calcifications, stimulate healing with stem cells as they're losing weight. So we're giving them excellent nutrition, weight loss, exercise, proper footwear, correcting their misalignments, and also giving them some treatments with shock waves to the joints and massage, and sometimes to increase circulation and nutrients to the joints to help restore joints. And we have people after being a few months, they can walk around, they can do more exercise, they have higher exercise tolerance, and they now can be moving and having a much better life, better quality of life.
Excellent. Another question associated with this is how, when you help the people with arthritis, how soon you can see them make the changes and be able to improve their condition and walk more?
We see tremendous improvement within the first month of the program. So even when the first month they're walking more, and by the month 3 they're doing really so much better. And even if they still have if they need to lose 150 pounds, they've only lost 50 pounds. They have 100 more pounds in their body, they're still feeling better. But we have them trained to keep making sure they're continuing to lose on the program every single week. So you're a nutritarian when you're eating so healthfully and you're at your ideal weight, or you're a nutritarian when you're eating so healthfully and you're losing weight at least 2 to 3 pounds a week, every single week. If you're not losing weight and you're overweight, you're not on a nutritarian diet. Because it's not just what you're eating, it's also the amount you're eating, when you're eating. It's control, making sure you're adjusting your calories to the exercise. If you can't do as much exercise, you have to cut back. You have to eat the right amount of calories. You still lose weight. You got to keep losing if you're overweight or you're not doing the program.
Okay.
I see one last question, and I'd like to get that in if you don't mind, Dr. Fuhrman. It's from Al Lunn.
It's really a question, about seafood. Does it have the same kind of harmful effect as meat?
Well, if you see food, you're going to want to eat it if you see it. It's better to have it not in your vision. That was such a stupid joke, but the joke
we all laughed.
To be funny, because laughing makes you live longer and is good for your health anyway. Even if the joke is really stupid. But anyway, let me answer the question then. Because the problem is that with agricultural runoff and algae bloom from nitrogen entering the waterways and the lakes, you have a lot of cyanobacteria growing and garbage and dumping of garbage in waterways. So now bivalves and shellfish, bivalves are clams, mussels, oysters, and scallops. Shellfish like crab and lobster have the most BMAA, the most of this toxin that's associated with Parkinson's dementia syndrome. There are clusters of ALS around people who are eating lake fish where they're dumping nitrogen waste from agricultural runoff in the lakes. And they're also off the coastal waterways of the major continents. You have increased dumping of plastic particles and microplastics. And when you eat sardines, for example, you're eating the digestive tract, and you're not just, so you have more plastic exposure. We used to think the bigger fish, like barracuda and shark and tuna, are full of mercury and toxic metals and PCBs. But now even the smaller fish off coastal waterways are full of microplastic particles and other toxins associated with plastic consumption. Wow. So our seafood supply has been contaminated. So we don't recommend people consume, more than a couple of servings of seafood a month. More than even 2 times a week is too much. So we're trying to move people more towards vegan diets. And even if you have too much seafood, then you're getting too much poisons, but also too much protein, which can raise IGF-1. So seafood has to be minimized or eliminated. We can't rely on seafood for omega-3 fatty acids anymore because too much dumping of garbage and plastics and agricultural runoff chemicals into the oceans and into the waterways. So I hope that helps. So unfortunately, because of the climate, because of our personal health, and because of our destruction of the, polluting in our world, we have to be more careful of what we put in our mouth today.
Thank you for that question. That was really eye-opening for me because I know my husband, he doesn't eat a lot of shellfish, but when we go out, it's one of the things that he loves to have.
No, it totally, that's exactly with me too. I would hardly ever eat an animal product except for a special occasion. But if I went on some kind of special occasion, what I would rather have is like lobster or shellfish or clams, or that's what I'd want to eat. And now I know that even doing that occasionally is probably the worst thing you could do because there's 50 times as much of a brain damaging chemicals in those bottom feeders because that's where the toxins develop. That's the most dangerous type of seafood you can eat. So the one I would almost ever eat would be the most dangerous ones. So I completely have to change that, flip over your concept and just do with what we're supposed to be doing,
Wow. That's going to be an interesting conversation. So I'm going to absolutely show him this presentation. I actually personally have one last question, and I think we should probably get ready to wrap up. We talk about protein, and a lot of times people will say, well, eating healthy it takes time, and I hate that question. But there are a lot of great, at least I think, I'm not sure, plant-based protein shakes, and I'd like your opinion on some of those.
Well, it's not that there couldn't be a acceptable plant-based protein shake, but it's not a substitute for eating healthy food. And plant-based foods, whole plants, have enough protein anyway. So unless you're putting a lot of oil and sugar on your food and taking calories that don't have protein in them, if you're eating a lot of whole natural plants like whole grains and nuts and seeds and beans and vegetables, you're getting adequate protein. So I think what I'm objecting to is this fear that it perpetuates that people think they have to watch the protein intake. They don't have to watch their protein intake. They just have to eat a healthy diet. If they're eating healthy whole plants, they're getting enough protein.
Amen. Thank you for that. And I think that, I think that wraps it up for our questions. So I want to thank you so much for being here with us, for giving us this great information, and for everyone who was here with questions. That was really helpful. And for those people who are here and for listening and watching the replay, we certainly hope you found Dr. Fuhrman's talk inspiring and informative, and truly that it motivates you to take steps toward adopting a nutritarian lifestyle. Now, for those of you who are here, want to watch the replay of this presentation or previous Wellness on Wednesday talks, please visit rochesterclinic.org. And all of those presentations are there. For those of you who follow me, you can also find them on Living Healthy List on YouTube. And we want to thank you all for joining us. And we look forward to guiding you on on your continued journey towards improved health and well-being. Thank you again for being here, Dr. Fuhrman. We appreciate your time, and thank you, everyone. Thank you, May and Dr. Lai, for setting up these presentations. It's been wonderful. Thank you, everyone.
Thank you so much, Dr. Fuhrman. Thank you.
Pleasure. Thanks,
Thank
Elizabeth.
you.
Thank you.
Bye.